the last topic I want to cover is like what your experience is going to be after you get home for the next few days or so after the procedure. So swelling is normal. Usually you'll be a chipmunk for a few days, so maybe 4 days swelling increases and then it gradually goes away. So typically patient after a week they look completely normal, like nothing happened. As far as pain, afterwards there is some discomfort. If I ask patients, if I were to call them the day after the procedure and I ask them what's the pain number from 1 to 10, I hear 4 or 5 very commonly. So that is normal. So it's not excruciating pain, but yeah, some discomfort is normal. There's medication that you can take for that. We'll talk about that, and we'll give you the medication. It'll be part of the prescriptions that you are given. So maybe 4 or 5. If the pain is more significant than that, then we can do something about that. And you have my phone number so that we can talk. So again, just to review what to experience afterwards. You just wake up at home. You probably won't remember going home. There'll be a little bit of bleeding for the first day or so. That's the most common question I have, or calls I get from patients is that, doc, it's still bleeding like the next day. Usually what happens is the patient spits in the sink and they see a little bit of blood mixed with their saliva. That's completely normal. So for a day or two, there might be a little sign of some bleeding, but in terms of any kind of significant, important bleeding, I won't let you leave the office if I know that it's like that. So you'll go home with some gauze, then you take the gauze out when you're sleeping, and we don't need any more gauze. There is going to be sutures on the lower teeth usually, and we don't want to disturb the healing with those sutures, so for that reason we don't change the gauze frequently. We just do one gauze when you go home, and then you can expect to see a little bit of bleeding. Talking and moving around, walking a lot is going to increase bleeding, so we recommend that you stay comfortable and quiet for at least the first day. I will give you my phone number now, so you can call me if you have any questions after the video, but my mobile phone is 415-297-9046. I'm also going to send you a text message in addition to written directions after the procedure, so your ride will have a text message from me that has my contact information and my phone number. Looking forward to meeting you and your appointment, and when we meet in person, I'll be happy to answer any other questions.